My name is Norm Bolsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
All right, welcome to the Digital Health Heavyweights podcast with your host, Norm Bolsky. And today is my honor to have a couple of folks I know well and a couple of members of the executive team from OneImaging, Elan Adler, founder and CEO, and Melinda Raymond, SVP of Sales. Elan, Melinda, welcome to the Digital Health Heavyweights podcast.
Thanks.
Thank you. Thanks for having us.
Absolutely. For all our listeners and viewers that aren't familiar, Elan is co-founder and CEO of OneImaging, leading disruption in the radiology space. Elan was previously in a clinical operations consulting and MR sales executive at Siemens Healthineers, an outpatient radiology manager at the Cleveland Clinic, Florida branch. Also has an MBA from Lynn University and a bachelor's from The Ohio State University in radiologic science. Melinda, thank you for being here. Melinda's SVP of Sales at OneImaging and formerly was SVP and head of employer sales at ShareCare for almost a decade. And prior, she was VP of product development at Healthways, which got acquired by ShareCare, and is an incredible sales vet in the employer and health plan space. So we're excited to dive deep into OneImaging and how your team is building accessibility, price transparency, medical literacy within radiology. OneImaging is the nation's leading radiology network, reducing the cost of medical imaging by as much as 80% for employers. And we are so excited to have you on the podcast. So Elan, after leaving The Ohio State University, which we are very fond of on this podcast, and getting your MBA, choose to enter the healthcare field.
I think that healthcare was just everywhere growing up. Norm, you and I are both from Cleveland, of course. Mm-hmm. Cleveland Clinic literally has its own zip code in Cleveland. A lot of people don't realize. So I'd say for starters, that's a big aspect. I would also say looking back as a young adult and trying to pick what you want to do is pretty difficult. And I would say healthcare is perceived as a very prestigious career choice for a lot of reasons, especially rooted in the desire for a lot of us who are in healthcare originally to become an MD. But there's a lot of nobility in the sense that you're helping others at a very high degree, which is crucial to another person's well-being. And, thinking immediately about it, the ability to help your family or your loved ones with the skills or knowledge that in the healthcare space can be really rewarding on a lot of different levels. And there's the aspect that you have a really nice amount of, financial security in return for putting in a lot of time to get into this profession that's very difficult and high stress.
Excellent. And Melinda, what inspired you to get into healthcare?
Yeah, probably like Elan. I think I knew from a young age. I remember probably at too young of an age watching the TV show ER. Mm-hmm. And, from second, third, like way younger than I think most people were watching that show. But I had older siblings and I remember we'd watch it on Thursday nights. It was just instantly drawn to this opportunity to meet people in a critical moment. And as you think about serving and helping and supporting and, all the great things that Elan talked about, I just knew from an early age that was where I was going to spend my life's work.
Yeah, a lot of people were, hooked on healthcare by George Clooney and ER. So you're not the first, you're not the last for sure. So Elan, walk us through your early career experience, boots on the ground, seeing out, how radiology works from inside of Ohio Health and Cleveland Clinic, one of the best hospitals in the world.
Yeah, I would say the first thing that I really learned was I had a sense of pride working for the Cleveland Clinic. So one thing that taught me was about the power of brand. I would say working at Ohio Health and Cleveland Clinic, they're huge organizations. So you learn a lot about systems and everyone has a very defined role that help these massive wheels move the organization forward. And I think I had the opportunity to witness the amazing potential of advanced imaging services, but also the inefficiencies that plagued some of those organizations. I think what exists at those organizations is something that you may have heard like Charlie Munger or others refer to, which is the principal agent incentive problem. He's famous for saying, show me the incentive and I'll show you the outcome. And I think that if you look at the bottom floor all the way up, you don't really have the same incentive to drive change and innovation, you can feel a little bit trapped. If you go out and ask nurses or radiologic technologists, there's that lack of incentive to be like, okay, this is a really bad experience for a member or a patient. You don't even know who you can talk to. There's no horizontal communication. It's so hierarchical and large of a system that you kind of lose that. And that's something that I really learned. I also worked a lot with like the VIP patient services there. So I learned a lot about what it meant to uphold the best quality services and I'll be proud of this brand that you're working for. But I actually do want to contrast that to the other aspect of my background, which is when I worked at Siemens in clinical operations consulting and enterprise sales. In that first part of my career at Siemens, I spent almost the entire exclusive amount of my time there working with the largest outpatient imaging company in the world, RadNet, where they didn't have that type of problem. So their innovation was much more on the nuts and bolts of creating better service and streamlined approaches, whereas Cleveland Clinic and others were more science-based in terms of that they're teaching hospitals. And I would say that what I noticed there's much more horizontal communication. They were constantly trying to push the needle, implement technologies that would improve resolution, improve scan time outside of just the main manufacturer vendors like Siemens. That's where I started working with Ezra, which is doing full body scanning. And they were constantly doing things to push the needle. And so that made me learn very much two sides of how businesses can be run. And ultimately, it made me obsessive over the nuts and bolts of business and patient experience, which I found to be underscored in the need for a more streamlined, patient-centric approach to radiology, which ultimately, helped me find inspiration to create OneImaging.
Yeah, I love that. And if you're within Cleveland Clinic and you see inefficiencies, God help the rest of health systems and provider practices. If they don't have it figured out, I doubt many do. Melinda, walk us through your experience. You started in product. Eventually you moved into sales, led sales, employer sales for over 8 years over at ShareCare. Kind of walk us through your career journey and, how it, helped you end up joining and leading, commercial over at OneImaging.
Yeah. I think very few people can completely predict the route that they'll take, especially in this space that has evolved so much over the past 15 years or so. I actually started at Healthways as an intern after my MBA program. So it was a long time ago, and I spent about 7 or 8 years on the product side. So I was leading product development, managing a group of designers and our outsourced technology partners. So thinking a lot about the front end design, thinking a lot about clinical innovation in web and mobile products. At this point, we were still largely living off of portals and web apps. And, we developed really the first kind of iPhone and Android apps that were really connecting the clinical team to the individual via a smartphone. And so think about how much that technology has changed and really paved the way for so much innovation over the last decade or so. I spent a lot of time when I was in product on the road with the sales team and demoing our products and talking about our products, and knew that if I was going to be a leader in a company, I think it's really important that you have the responsibility of revenue, that the weight on your shoulders of knowing what it's like to grow a company and to feel that pressure. And so knew at some point I wanted to make that transition and was given that opportunity right about when ShareCare acquired Healthways. Mm-hmm. So really got to kind of learn a ton, and I knew the product really well. And so I think I came at sales and business development from a little bit different perspective, just really thinking about how do we solve problems and how can our solution be flexible, be configurable to really meet a lot of needs. And have got to lead a great team. When I left ShareCare about 3 months ago, I had been there 14 years. So really a long time in this space, especially, and, was excited to jump in and kind of join Elan on the work that they were doing.
Yeah, I think it means a lot when someone leaves the company after over a decade. Like whatever they're doing next, they're probably pretty damn excited about it. So that's great. Really excited for you and happy for you. And I think the other thing that I take away from what both of you shared is I think, Melinda, you were extremely successful at ShareCare in sales because you were a subject matter expert. You're a product person. Like you knew that product inside and out because you worked on it and developed it yourself with your team. And I think that's also why OneImaging has had a tremendous amount of success in such a short period of time, is because Elan's an SME in this radiology space and he knows it inside and out. And now he's teaching the whole company how to be able to explain what this is and why it's such a great benefit to patients and employers. So I think that's key to success for a lot of our viewers and listeners. If you want to be a really effective commercial, person and sell a product, first thing you need to do is become an expert in it, because if you're not an authority and you don't sound like an authority, you're probably not going to move that sale more than a couple inches. So, great stuff. What were some of the biggest successes and learnings you had from those 14 years at ShareCare, Melinda?
That's a great question. I think just the reality of needing to constantly innovate in the industry that we're in. ShareCare made 18 acquisitions over my time there. And so we were constantly rethinking how we sell, what we sell, how we can meet the member where we're at. And I was fortunate to work for a pretty visionary CEO and Jeff Arnold, who we always talked about was like always seeing around corners. And, Jeff, one of the acquisitions I specifically remember was Jeff purchased a in-home care company in probably 2018, 2019. And, he could have never known the pandemic was coming. And then fast forward and how much healthcare has moved into the home. But it constantly evolved kind of how we talked about what we were doing. So yes, we were always kind of offering a wellness solution that really evolved though into an advocacy solution and all these different facets of what we were doing. And I actually think that's what's afforded me the ability to jump into a much different company that's, much smaller, not post IPO, not a publicly traded company, was that ShareCare always felt like a startup. We were always innovating. We were always thinking about what was next. We never were kind of resting on what we were doing. It was always kind of pushing the envelope in that way. And I think that's just a necessity in the industry that we're in, is to always think about, how can you improve? How can you do this better, different, more efficiently?
Yeah, love that. Elan, what major problems did you see in your previous career that really enlightened you to start and found OneImaging with your co-founder, Mert?
Yeah, of course. I think the first thing is the cost of imaging. Mert, I've talked about this all the time. Mert doesn't mind me sharing. He got into a car accident. It was non-emergent. He walked in to get CT scan after seeing the doctor and comes out. This is before we started OneImaging, and he comes out later, and he knew I was working at Siemens. He's like, "Yeah, I got a surprise bill. It was $3,200." And I was like, "What'd you get done? Well, total knee surgery?"
Yeah.
And he's like, "No, I just had a CT scan on my neck." And I knew that if he had gone to a place that I knew about, I could have helped him in advance. Probably could have gotten that done for a lot less money. So I think the first thing is the cost. That CT scan probably took 5 to 10 minutes maximum. To me, it doesn't compute in my head of a 5 to 10 minute exam, probably less than a minute actually inside the CT machine, probably less than 15 minutes charting on doing everything all in. It doesn't compute to me that it would cost $3,200. And so the main thing is, how do we get those costs under control? The next thing I would say is simplicity and accessibility. When we think about Apple or Uber or Airbnb, it was complicated before we had big logos and apps for everything. And so how do we curate that into healthcare? I actually read something today from one of the co-founders of PillPack who were saying, how do we bring that aspect of simplicity that they've used in other areas of technology into healthcare, or making healthcare more like that? And I think about that a lot. Maybe we aren't all the way there yet in making things as simple as getting an imaging exam like you would in Uber. But how do we make it at least feel somewhat close to that? And also, why is there a lack of perceived options in the sense of, well, I might live 5 minutes away from an imaging center. In fact, I could tell you there's literally about less than a mile from where I am currently sitting right now is an imaging center that we partner with that has really good technology. And why is there not a perceived option for me to go there when A, I might know that it costs a lot less, B, it's way more convenient for me. So convenience, simplicity, why isn't there something that just enwraps all of that? So it's like, boom, I can go there, get it done, get in, get out, not have these crazy wait times, not sit in a waiting room for 2-3 hours, get my report super easily so I can share it with a specialist. Why are there all these barriers for the people that are paying for the exams? That to me is mind-blowing. And so that's a huge area that I really wanted to solve. And of course, I know what that imaging center, across the street has. But my parents, my friends, our customers, they don't know. And so you can't really just go on Google and say, maybe I could call the center. First, I'd have to know that the center has this equipment. Then I'd have to find out what model they have. And then I'd have to say, okay, how do I know if that is good equipment? I can't go on Google and look that up, So there's a third party now that's actually going to do all that quality check for you. So you don't have to get unnecessary radiation exposure, repeated scans, waste your time, waste your energy, waste your money. So those were some of the things, and care coordination to support people too, because they've got questions. A lot of people don't even know this, but they put some silver lining and threading inside of yoga pants even these days because it's antimicrobial or antibacterial, right? What can I wear? What can't I wear? Simple things. And there's no support today from anyone on these types of things. Long story short, we want to make everything really simple, really affordable, save people time, save people money, make it a win-win for everybody.
Yep. I've been a big fan since I learned of the company at Health 2023. And anyone who's willing to listen, I always tell them OneImaging is probably the company I'm most bullish on that I've met in the last 5 years. So I think to summarize what Elan shared, it's essentially your easy button. If you need radiology services, they're going to find you the cheapest, most efficient, best quality center for you to get that. And ideally, but depending on plan design, it could be zero copay a lot of the time, sponsored by the employer. So that segues into, Elan, how did you decide to sell to employers? I think a lot of companies just kind of fall into this market. How did you kind of decide, this is going to be my customer type?
So we didn't actually start with employers. We actually started as a B2C model out of our apartment, like literally working out of our apartment and just putting something together and just seeing what that looks like for people, right? How are they going to respond to this? Well, they don't, because people want their exams to count towards their deductible. That's the most important thing. You're already paying for health insurance. Also, it's not easy to put a healthcare product in front of a B2C channel because a few things, healthcare is not something you think about until you need. I would say in addition to that, it's not something that people are thinking of themselves as, consumers in that sense for. It's just not something that people do, especially when you think about the people who are getting healthcare the most. They're not thinking like, let me go online and download an app or go on a website. And also imaging is not a service that 80% of people use often. The top 20% of people actually make up a very large majority of the exams and spending, and that's represented in a lot of data that we've seen that have chronic conditions. So I would also say that you just have a lot of people that are, especially now today, just not going to see that as B2C. So we moved it to employers because something that I could refer back to of that principal agent incentive aspect, right? Where we can save employers a ton of money in health plan spending. We can save their members a ton of money in out-of-pocket spending, out-of-pocket costs. There's just a lot of incentive along the entire chain there where it makes sense. And you also have a way to educate people who will most likely, need to use radiology or radiologic services now available to you. So there's a lot of it has just to do with the incentive and the way that people are informed about it. And I think we've been really creative there as well with how we actually get our product in front of people. But that's, I think, the main aspect.
I love it. And I think it's very timely that this product is entering the market because companies that have a similar model and have provided a lot of value to both employers and the patients themselves have done extremely well, even in this current very unique economic environment. So kind of comparing it to other companies, some of these viewers and listeners have maybe seen very similar model to how like a Carum works in COE, bundled payment for surgery, as well as cancer treatments, and very similar to fertility companies like Progeny and others that have helped the patient get access to top care, top quality at bulk pricing discounts. And that's where this comes in and really, really shines. So Melinda, it's funny in my profession, depending on which recruiter you ask, some people, typically the folks on the tail end of their career that have, been around the block for, decades, they'll cut off at like 8 to 12 years. If someone's been at the same company for 8 years, 10 years, 12 years, every person has a different cutoff. They just give up on those people. They're like, oh, they're just going to retire at their current company. They're never going to go anywhere else. So just out of curiosity, after 14 years over at ShareCare/Healthways, why was this the one you jumped for? Why is this the company that you decided, hey, like this is where I'm going to spend the next decade of my career?
Yeah. Well, I'll attribute some to your salesmanship, and in terms of your vision and your bullishness on the company. But I think really I was introduced to Elan early on when Elan came to ShareCare to really pitch a partnership. I ran partnerships at ShareCare as well. And so I saw a lot of these organizations that were coming in, and there wasn't a single time where I was so compelled and impressed with both the product and the value. And so especially in the market right now, there is such a thirst for how can we reduce cost and do it quickly. And solutions that are saying, hey, we can think about cost avoidance 3 to 5 years from now. Like, that's great, but that's not the need that employers need right now. So I was really compelled by the product and the value and the opportunity to go help grow something. I saw the immediate value. All of the early conversations I had and indicators I had were that this could be tremendously successful. And so I took the leap and have been thankful for it since.
Glad to hear that. Elan, starting a company's not easy. You get kicked in the teeth a lot over and over and over again. And then when you achieve a certain amount of success, gets a little easier, but it never is easy. You and Mert, what were some of the major challenges in founding, OneImaging?
I would say to start, just like running on fumes. I think in health tech or digital health, you can't really just sell an idea. You have to have a product ready. Mm-hmm. And that can be expensive and it can be time consuming. And I think that in healthcare, there's a huge education barrier, especially on the benefit side. Knowing how to integrate with things, where to integrate with things, who to talk to, how to position like what you're doing properly. So there's a huge education aspect. That's on the product side, but then pivoting it over and making sure that as we're bringing this into employers and other groups within the sales cycle and the purchasing decisions, learning that new purchasing decision timeline and what that cycle looks like. So it's a different type of buyer that I had to learn about. And that was challenging. And part of that education too is what I didn't know is that a lot of people look at the industry in like a disease specific way. So when I started to learn more, I always thought it was so interesting. People would look at musculoskeletal or diabetes, but they weren't looking at service lines as much, except for prescription drugs was always looked at as a service line. Surgery, of course, is, but it wasn't looked at that way. So there was like an aspect of education where, okay, imaging actually affects women's health and pelvic conditions and your mammograms. It affects surgeries, pre-surgical planning, and post-surgical implants integrity. It affects diabetes. I have a very close family member who has to get liver scans regularly because they're a diabetic. Like a lot of people don't realize that, or the amount of infections you get from being a diabetic. These are things that I saw from my time as a clinician too. So I knew this. Oncology, obviously a ton, tracking the progression or remission of cancers and heart disease, of course. And so it really plays into every section of care. And so figuring out a way to properly educate the market that imaging affects 51% of people age 18 to 64. It's the second most utilized service by volume of claims. And let's pull imaging out of all these areas and say, this is what imaging is. And it makes up, 10 to 20% of plan spend. I think a lot of the market, they've heard about imaging, they know it's a problem, but they haven't actually ever looked at it a lot of the times in this way and know that there was something that they can do about it. So I read a lot about and listen to a lot of other healthcare founders, whether that's V from Sword or Dan Perez from Hinge. One thing I heard, Dan say was, bringing a new product line to the market is like bringing like the first computer or TV to the market. When at first wants to be the first person to have a TV or a laptop.
I remember when he was I'm getting all nostalgic here.
Yeah. And so I thought about it the same way. I was like, yeah, that makes sense. I mentioned my father was in technology. He bought a laptop in the early 80s. And I remember he said he spent like $6,000. I'm thinking to myself, you're insane. That's not what I spend for laptops today. And he was able to learn so much and be probably ahead of his time quite a bit in that sense. And so I think about those aspects and think this is a new thing. And so getting over some of those early barriers, I think, is one of the most difficult things.
Yeah, creating a new market category is not for the faint of heart, but for the ones that do and do it successfully, can be, great to be first mover advantage, without doubt. All right, we talked about the challenges. Tell me about some of the successes. You mentioned a couple customers. You got Melinda's, one of the top commercial minds in the whole country. So there's a couple right there, but what else can you share with us?
I would say what was challenging that is a success is the technology that underpins everything has huge ramifications, of course, that I get really excited about for the future that I think the industry can move towards. Not imaging, but all the healthcare, in the way that the flow of payments and claims work. And we created this really amazing solution that tethers things together and reduces administrative costs to essentially net zero for us. And here's a crazy statistic that I didn't know going into this, but 30% of all healthcare costs are administrative. And we figured out a way to make that essentially close to net zero for us. And that's something that's a huge success that underpins the way our whole system works. Getting Melinda and Chris Davis and some of these other folks on our team, huge. And so to be able to build a culture that I'm really proud of, I think is a success. When we had our first booked appointment, it was a huge success, in my eyes. I celebrate each and every success along the way, of course. And I would say creating that system that enables us to get all these providers to work with us, that actually creates a lot of savings and value for them, which is why we're able to get these better costs. That's something I'm very proud of. That is a big success. So I would say I look at the data in real time every day that we're seeing $1,000+ that we're saving people.
And I think what's so exciting about what your company's doing and when, Melinda and you are selling new accounts is, yes, you're saving these people thousands of dollars, but there's some people that the sticker shock of how much it would cost without you guys might delay or even not even get imaging. And that can ultimately change the entire care plan for them. If we're talking like oncology or heart, like that could cause early fatalities.
38% delay or forego.
Really scary concept. So I think there's so many downstream things that, you and your company are doing that really is, way more benefit than meets the eye initially. And the more you learn and the deeper you dive into it, the more you see like how valuable this truly is.
Yeah.
Appreciate it.
We launched with a client just a few weeks ago, and we announced the partnership, but we hadn't actually gone live, and we had multiple people that were like already trying to sign up. Elan mentioned this before, but it was new to me, and I'll just say it again, that 20% of people account for 80% of your radiological spend. And there's individuals that are getting 10, 12, 14 exams a year. So you don't actually have to engage 100% of the population to make a pretty big dent in your healthcare costs. And this is all, learnings I've had over the last 6 weeks, but really being able to target those individuals and just the relief and the value that you're providing to them is so great that even before we launch, they're reaching out and seeing, how they can schedule the service.
Yeah. So Elan, when I met you first at Health, I loved the value prop and like what exactly the company was doing, what the goal was. I think maybe my first question to you was, okay, sounds like a really cool model, but how many imaging centers do you have? And when you said like 4,000 plus, I think my jaw hit the floor. So walk us through how you built 4,000 plus accredited centers across 48 states.
Yeah. So I did have the fortunate advantage that I spent many years working with health systems, setting up their breast imaging program or selling them an MRI machine and working with all their radiologists. I would say there is some consolidation that helped, but I spent pretty much a year and a half. The first 3 to 6 months, I was pretty much going through the entire install base list out of my apartment, like literally just going through, put it into an Excel, went through every single one, checked on the quality, the equipment that they had. What is also really important that a lot of people don't know is the software that underpins the equipment as well. So if they had like motion corrective AI on the actual MR computer, so when you're controlling how the image is being taken to prevent blurry images that would create misdiagnoses or repeat scans, which are a huge waste. So actually looking into all the nuts and bolts, if they had like auto alignment technology, so that way, an image is auto aligned to like an ACL, for instance. Mm-hmm. So that way you can see if there's a tear, like literally going through this entire list for months, very carefully, making sure that they have all their accreditations, that they have board certified radiologists there, subspecialized radiologists, that they had ACR accreditations and everything under the sun. And then calling up some of these folks that I already knew and sharing with them what we do. And it was actually pretty difficult to start. And then we kind of hit our groove in terms of who we need to talk to at these places and the way we communicate what we do to them, because this is like completely new to hear that there's like a radiology benefit management solution for these people. Yeah. Even before that, we were actually just originally bringing on people in a B2C function and gathering, rates from them and things like that in exchange for the value and saying, here's how we're going to save you money by doing this. And, bringing new patients, reducing cancellations, guaranteeing reimbursement, things of that nature that is typical in the COE model. And then I hired a team of people and trained them on how I communicate that value to them. Mm-hmm. And slowly but surely, after a year and a half, we got to that number. We're still working on it every day, though. So every day we're removing centers that are going out of business or, sold maybe their MRI machine or their CT machine, and then updating with new businesses. Funny enough, our actually neighbor in this office building has actually just opened up a center and like added them. It's actually just a constant management, making sure everything's updated, making sure that if there's new businesses, we can work with them. But it was just figuring out how to communicate the value over time. That took a lot of iteration.
Maybe 10, a little bit over years ago, no one knew that like diabetes management as an employee benefit existed. Yeah. 8 years ago, no one knew musculoskeletal, remote physical therapy was a category, and that was possible to be offered as an employee benefit. Same thing with mental health, probably about 10 years ago. Wasn't really something people were talking about. Even 6-7 years ago, like COE for either fertility treatments or surgery, like that was something no one had really heard of before. So a lot of things that, maybe now aren't really something that people have on their radar. A couple of years from now could be top of mind, could be like the biggest new category out there. I think there's a lot to be said for something that can help this amount of the populations. When you're talking about this impacts over 50% of patients in a given year, benefits leaders must take notice. Melinda, as SVP of Sales, what have been, your initial impressions and, some successes that you've had in this first, 3 months of your tenure? Yeah. I know asking this, in something that's usually a 12-month plus sales cycle is, a little bit of a difficult question, but I know you're up for it.
Yeah. I've been super encouraged by the early conversations. So, just as a quick example, we met with a client yesterday. It's got about 5,000 lives. And we always take in multiple years of claims data, do a full opportunity analysis to understand what the impact was. And for their 5,000 life group, we can save them over $2.1 million next year. Wow. And so the savings are just so real and so near term and so evident. We often get asked about like, how are you going to get utilization? And I think to my point earlier, there's just such a targeted approach with imaging that you don't have to go after everyone. But also we've thought about some really creative ways to kind of intercept that individual. We also kind of are bullish that imaging is probably a little bit different than changing surgeons, that, getting your CAT scan at a different center is probably a different level of kind of cognitive or emotional concern than some of those other procedures are, is what we're seeing. And so for people to understand the value, they're pretty quick to be like, yeah, I'll drive 3 miles down the road if I'm going to, have $1,000 put back in my pocket. So I think the value's been really clear. I would say from a challenge perspective is that, and I knew this, but it wasn't crystallized to me until the last 6 weeks, that even solutions that can be as valuable as that, your biggest competitor is the status quo. There's so much fatigue right now of point solutions. There's so much fatigue from benefits buyers of, they've got 10 to 15 solutions already and you're bringing them something else. We've got to continue to find ways to fit within the ecosystem they already have built. And we've got to find ways to make this easy. And so that's why we can do kind of no upfront cost. We can turn this on pretty easily. We're really working to say, we know you're tired. We know you're fatigued. We know it's easier just to do the same thing, but how can we make this easy? Because the value is clearly there. And I think they're seeing that.
Yeah, that's great. Elan, you mentioned 10 to 20% of an employer's spend is in imaging and associated with radiology. Can you go into just under the surface, other than just like the cost of the image itself, what else OneImaging is doing to help your employer customers reduce cost?
Yeah, we really just want to like focus on providing like the one thing and one thing really perfectly, which is imaging services. And there's downstream components, right? Are we, working to make sure there's really high adherence to mammogram screenings? So this past year, mammogram screenings, the age to get that done, the recommended medical guidelines went from 50 to 40. I have family members that have had breast cancer, carrier of the BRCA2 gene myself. How do we make sure there's good adherence there so that people can catch things before there's a, terminal illness? You were talking about people that delay or forego imaging due to cost. The number is actually 38%. So how do we reduce
terrifying.
that? Yeah, I mean, your doctor says you should go get imaging, and you go to get the exam and it's thousands of dollars, 38% delay or forego because of that, or don't even show up and try to find out the cost because it's so expensive. They know like an MRI is historically very expensive. And so yeah, that's a huge component to it. We have care coordination services, of course, so really facilitating everything. The kind of principle that I wanted to instill is having really good engagement without people remembering that they have OneImaging. Again, it's kind of like the whole component of simplicity. It's really just about having a system that's there for people without them even realizing, like a complete safety net, whether that's through certain integrations we have with their plan or whether that's through different tools.
Yeah, walk us through patient experience. So let's say Jane at XYZ and Company needs a MRI scan and her employer is a OneImaging customer. What happens? What is Jane's experience?
Yeah, so good segue, I suppose. I think the first thing that's kind of unique is having our information labeled on their primary insurance ID, whether that's in physical or digital form, because first thing that happens today, and I always give this reference, today you have the option to send my prescription to the hospital's pharmacy. Let me get it online and just give me the referral. Maybe I'll get it at CVS. Maybe I'll get it at Walgreens. Maybe I'll get it at the pharmacy in Kroger or Target, right? Well, that doesn't exist for doctors today until us. Well, now our information's right on your insurance ID, and there's a place where there's actually the ability for providers to send in their order to us. And the problem is providers don't have an exhaustive Rolodex of imaging providers closest to them. So they may send all their patients to one location, creating a huge bottleneck, right? So what happens? We get the referral in to us or integrate with the plan in some manner. So we know that the exam was ordered through one methodology or another, such as data feeds. And we will actually reach out to a member, and it's that similar experience. Hey, we received your order. We received your prescription. Click here, call this number to book your appointment. You click into it. You immediately have that Airbnb-like Uber experience to see all the providers. We run it through the exam. We pull in the information and run it through your plan so everything's transparent. You know the exact cost with your cost sharing. You can request that appointment where you want to go, when you want to get it done, whether it's the soonest available appointment or a specific date and times that you want. And then we'll go and coordinate everything for you. And then you simply go in to get that exam, and we send you we call it like a boarding pass. Essentially, when you go to get on an airplane, you have a boarding pass on your phone. Essentially, it's a virtual card, and you go and use it at the imaging center, and it transmits, reimbursement to them, and the report then gets sent to them after the exam to their login, so they can share it with specialists, and then everything's kind of set from there, so they don't really have to worry about anything. That model kind of takes care of everything that they need from that perspective.
So when we initially met, the first thing my mind went to when you mentioned, hey, like these employers are saving 60 to 80% on their cost of an imaging scan. I started thinking whenever I save 60 to 80% off retail, I'm usually having to jump through a lot of hoops. I'm usually having to wait and do certain things that make it a little less convenient, but the price is good enough where I'm willing to do that. So I asked you, hey, like, what do wait times look like? Like, how do you get your patients in a timely manner? And you shared with me, they get in quicker when they use OneImaging as opposed to going the traditional route. Can you explain why? Because it is counterintuitive. And
not bashing health systems here by any stretch.
yeah.
First and foremost, again, was proud to work at the clinic, but I'll just give like an example. One thing that can happen if you go into like a hospital department is they may actually be taking care of inpatients in between the outpatient scheduled. Like an outpatient schedule is combined with the inpatient schedule. And so they're trying to squeeze in complex inpatients. So like when I worked at the clinic, what was crazy is you would have this back-to-back-to-back schedule. And it starts 12 a.m. to 12 p.m., right? Every day, like 12 a.m. to 12 a.m. really, it's 24 hours. And so you have, patients from the ICU coming down in hospital beds with leads. You have to remove all the leads. And this could be ordered stat. So you have to fit in these stat exams. And now you're waiting in a hospital, and the reality is you're waiting there for 2-3 hours. That schedule's bottlenecked. That's where that physician's sending all of the imaging. So now you're waiting 2-3 hours when you get there, on top of actually waiting a month and a half to get your appointment, because we're actually seeing a shortage in technologists, MRI, CT, X-ray technologists, workforce shortage by about 20%. That's, I would say, more adversely affecting the hospital systems due to people not wanting to be on call, due to, post-COVID environment, or just being around more sickly people, as opposed to the outpatient space where it feels like you're going into an office building. So there's like a different structure in terms of, what people are looking for, and flexibility in hours, working 9 to 5 or 9 to 8 hours rather than through the middle of the night. So that creates a workforce shortage, creates long wait times to get the appointment, long wait times when you arrive. So that's kind of, that reason why it is actually counterintuitive a lot of the times. But those outpatient centers aren't servicing inpatients at the same time as well.
Yeah. At scale, like OneImaging is going to be referring a lot of patients to these imaging centers. So when a patient who is supported by OneImaging's benefit, you walk in, you're like a VIP, you're a OneImaging patient. They're one of our top clients and customers who got to treat them right. So I think that's got that advantage for it as well. So I ask every single person who comes on this podcast, hey, we spend our day in healthcare. We love it. It's our profession. But how do we practice what we preach in our personal lives? How do we ourselves live, breathe, sleep, wellness, and health? So I'll ask you two, because, running a small company and making it brand name, not for the faint of heart. We've already discussed that. How do you, in two very stressful jobs, one founder and CEO, the other leading the commercial function for a company with just massive upside, how do you, participate in wellness? What do you do to exercise and reduce stress?
I'll go first. So I was a college athlete, so it's just kind of in my blood to exercise. So I've run marathons the last 2 years. I ran Chicago last year and the Marine Corps the year before. So definitely running. I am addicted to pickleball at this point. I mean, I think it's just something that may happen at a certain age, but just loving playing pickleball in our neighborhood. I've got 3 little kids, so they keep us pretty active. So we're constantly hiking and biking. I live in Asheville, North Carolina. So there's just a plethora of opportunities to be outside and enjoying that. Definitely stay active and, really try to keep the focus there on raising healthy kids, raising a healthy family, but also staying healthy myself.
That's great. How about you, Elan? You live in Miami, plenty of sun.
Yeah. Yep. Try to be out in the sun, walk quite a bit outside, except for like the next 3 months. It's a little brutal, but try to walk around a lot outside, live in walkable neighborhoods, do like weight training 3-4 days a week, run usually once a week, and try to really just eat healthy. And you saw the ring situation going on. So I'm not an investor in Oura Ring, although I wish I was. Because I'm enjoying it. It's pretty cool being able to track sleep and all that stuff. So I'm trying to make sure that I'm like on a good schedule with that and tracking like recovery and just like keeping in tune to how I'm feeling, but just eating healthy and just and exercising a lot.
That's great. Shameless plug. We'd love to have the Aura folks on the podcast when the opportunity strikes. And you mentioned, both of you, like healthy eating, like big part of being healthy is ultimately what you're putting in your body. I think a lot of us, we have big responsibilities at work, building a family and have kids, and time is a very valuable and scarce asset. Are there any healthy recipes that you make at home that are quick, whether they're pre-bought and assembled or like full, like homemade from scratch recipes that may inspire someone who's trying to eat healthier but needs a little inspiration? Do you have any ideas for them?
Norm, I feel like you need to make these shareable, because I've listened to several other episodes of your podcast, and whether it's Julie or Maroof, like I want to have these recipes that they're talking about. So you got to find some.
That's in development.
Okay.
We are currently in the process of installing a stove oven in our corporate office, like where I'm in right now, so that we can test some of these recipes that people recommend on the pod. So
yeah,
you're one step ahead of us. I love it.
Coming 2025. Right. We love to grill in the summer. I feel like put veggies and grilled chicken on and kind of eat that throughout the week on salads. I feel like it's an easy way to stay healthy with fresh food and spend some time outside as well.
Elan, you got any good recipes or meal preps that have worked out?
I feel like this is a trap here. I'll throw some like Greek yogurt in a bowl maybe and some raspberries on top and get a little cute with it. Yeah. The other day, out of the norm, I made like a homemade Chipotle bowl, like grilled steak, rice, lettuce. Outside of that, you can pretty much see me at like a fast casual place that's like one of those healthy fast casual salad type places, like 3, 4, 5 days a week for lunch. So
that works. Whatever works, stick with it. Well, again, both Melinda and Elan, thank you for joining us on the Digital Health Heavyweights podcast. We will be very eager to continue to see OneImaging's explosive growth, and congrats on all your success so far. And we only know it's the beginning. So thank you for joining us. And I'm sure we'll have a follow-up episode a year or two from now, and we'll look back and talk about a lot of the future successes.
Awesome. Thanks, Norm, for all you do. We appreciate it.
Thank you.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.